I'm a student physical therapist assistant, and I'm going to be helping you today for your aqua therapy session. Can I just have you confirm your name and date of birth?
Gianna Ponce, 0927.
Okay, and then also the date today. Are you aware of the date today?
Today is November 1st.
Yes. Okay, and then do you know where you are?
I mean, I'm at my aqua therapy.
Yeah. Okay, and do you know what we're going to be kind of doing today?
Aqua therapy?
Yes, okay. So, I'm going to bring you in towards the pool, and then I'm going to have you have a seat, and then we'll kind of go over our plan for today. Okay, so we can come right over here. Okay. And then you can have a seat right here. Okay, Gianna, so I'm just going to go over a couple things before our treatment today. So I'll go ahead and take your vitals in a second here. But first I'm going to go ahead and ask you a couple questions. So are you in any pain today?
A little bit.
Okay, yeah, I know you had a flare-up with your RA not too long ago, and you're kind of getting through that. So the aqua therapy should feel really good today. So I'm going to go ahead and go ask you a couple questions. So are you having any like nausea or incontinence in the last couple days?
No.
No. Okay, have you been having any like trouble breathing or respiratory issues?
No.
Any open wounds as of lately?
No.
No. Okay, and how do you feel about being in the water? Are you uncomfortable in the water at all or fearful?
Nope.
Okay, so it looks like you should enjoy today's session. So I kind of assessed your gait also as you were walking in with your canes, and I was kind of noticing your flex posture at the hips and the shoulders. So we're going to kind of work on some lengthening of your anterior, like your hips and things like that, and strengthening the back side. So that will kind of help you with that. So I'm going to go ahead and take your vitals first before we get in the water. Okay. So what is your normal blood pressure usually?
120/80.
Okay. And do you have any stents in your arm or any birth control implant?
No.
No. Okay. And I know you said you were in some pain today. If you were to rate that on a scale from 0 to 10, 0 being no pain, 10 being worst pain of your life, what would you say you're in today?
I'd say a 4.
A 4, okay. Okay, so you said you're normally 120/80. So I have you at 118/82. So pretty normal, within your normal range. And then I'm going to go ahead and do your heart rate. Okay, so, or your pulse rate, same thing. Okay. Here, oh, my nail's gross. Okay. Okay, you're at about 76 beats per minute. So that's within the normal range for resting. So normally we would do your pulse oximetry, but ours is broken. So have you had that done recently?
Yes.
And it was like your normal range?
98.
Okay, perfect. That's within range as well. Okay, so kind of a breakdown of what we're going to do in the water today. So I'm going to lead you through, we're going to stay in the shallow end. Normally the water would be warmer, but it's not today, unfortunately. But we're going to go ahead and do an aerobic warm-up to kind of get your heart rate going and get your body warmed up and ready for exercise. So we'll do that for about 5 minutes. We're going to do some walking. I'm going to take you through some stretching for the hip flexors and your hamstrings. And then we're going to go ahead and strengthen the posterior chain, so your glutes and hamstrings, calves, things like that, to kind of help with your posture. And then we're going to do one full body exercise that I will assist you with. I'll be in the water with you the whole time. And then after that, we'll come out, we'll reassess your vitals, see how you're feeling, and go from there. Okay, so now we're going to get in the water.